I think Agarwals Eye Hospital has a very strong history as far as academics are concerned, because right from its establishment, the people who first started it, Dr. Mrs. T. Agarwal and Dr. J. Agarwal, have been a couple who have been academically oriented from the start, and that ethos has permeated through till the present year, and it is even now very academically oriented. We have a strong academic session going on throughout the year. We have postgraduate fellows, about 6 a year, who are enrolled for the 3-year postgraduate course, which is equivalent to the MS Masters in Ophthalmology, the DNB program, and so we have about 18 at a time, and we've trained more than 30 ophthalmologists in the Masters program so far. We've got a very strong optometry program, a college of optometry, which has been running very well, and at present we've got 120 students enrolled, 30 per year, which is really a huge number. We have also the fellows, which is a very creditable point to any institution, because for all the super specialties or the subspecialties that we have in ophthalmology, fellowship is something that the surgeon who's already completed his masters comes for, and this shows that they have so much confidence in the training that is received at Dr. Agarwals Eye Hospital. We have fellowship for cornea, retina, for squint and oculoplasty. We have fellowships for glaucoma and all the other specialties, refractive surgery, cataract, and so on. Research and innovation is something that the team at Dr. Agarwals Eye Hospital has always placed a lot of importance on, because we know how important it is for the hospital to remain at the forefront of technology, and to also be able to make this technology surgeon friendly and patient friendly, as also available in a manner that is available to a huge population, right from the richest to the poorest. So we've got numerous innovations to our credit, and we've received international recognition for all these innovations in numerous forms, such as awards, peer-reviewed publications, citations in journals by other authors, and so on. As far as cataract innovations go, we've been having numerous new techniques to our credit. We've brought out phaconet or bimanual phacoemulsification, which sized down the cataract incisions to about 1.1 millimeters, and this was further downsized to about 700 microns, which is about the thickness of, let's say, 7 to 10 human strands of hair. And this really has a lot of impact on the patient's ability to see things more clearly and to have a better post-operative course, a much more smoother post-operative course, which with a decreased incidence of post-operative complications. In cataract, the other great breakthrough that we had done was the glued IOL technology. This has made available the reality of having an intraocular lens placed in the eye in even the most complicated and challenging situations. For example, for patients who do not have the normal bag where the intraocular lens is normally placed, we can easily anchor the intraocular lens to the scleral wall using the glued IOL technique, which we use as a biological glue, and this has given the advantage of intraocular lens placement even to patients who have been aphakic or who could not have the IOL placed within the eye because they were operated ages and ages ago, or to young children who have congenital problems where the lens cannot be placed in the bag. The IOL can now be placed using the glued IOL technique, or to patients who have suffered injuries in the eye and where the lens could not be placed. Again, the glued IOL offers a very good solution to all these patients and many more complicated situations. We have also brought out in cataract the no anesthesia technique, whereby patients who are fearful of getting injections in the eye or who might have allergic reactions to the drug are now being able to be operated by using absolutely no anesthesia at all. We've done the air pump, which increases the safety of the technique, and then many other innovations as well. In refractive surgery, we brought out the concept of a totally new refractive error, a fourth refractive error, which we have termed as eberopia. There are only three refractive errors which have been described so far: hyperopia, myopia, and astigmatism. But we have brought out the concept of a fourth refractive error, which is eberopia, and which is based on the higher order aberrations of the patient. So even if a patient had been told by his local ophthalmologist that his vision could not improve beyond a particular limit, it is now possible to evaluate him to find out whether he has this condition called eberopia and see if he can possibly be treated upon. In retina, again, we have made huge leaps. We have a new foundation called the Dr. Agarwals Retina Foundation, which is totally dedicated only to retinal services. And again, as far as innovations go, we brought out the technique of FAVIT, which is basically being able to bring out a lens or a cataract that has gone into the eye, into the vitreous cavity of the eye, bringing it out safely, and then again implanting the lens. We have been involved in the first trial of the mirror telescopic intraocular lens worldwide, and this is a very prestigious thing. and the first implantation of this IOL has been done here in Dr. Agarwals Eye Hospital. The other major breakthrough which we had was in cornea, where we did the complete anterior segment transplantation for the first time in the world. Up till now only the cornea was transplanted, or a large corneoscleral rim, but this proved very fruitless in most patients, and we could reconstruct the entire anterior segment right from the cornea, the sclera, the intraocular lens and the iris using a bioprosthetic device which we devised ourselves, and this was used for extreme cases where no other treatment was available. We've also got new advances in other departments such as oculoplasty, where we have improved cosmetic outcomes of ptosis using a very minimally invasive technique. The number of scars on the face being reduced to just 1 from 5, which is the conventional technique, which leaves a very less desired outcome, but using our technique it's just a single tiny scar which improves the cosmetic outcome a lot. We have been rewarded with all our efforts that we put in for innovation and research and development by way of international recognition, which is the greatest that any ophthalmologist can desire. We've got peer recognition and international awards, more than 18 to 20 awards from the American Society of Cataract and Refractive Surgery, European Society of Cataract and Refractive Surgery, American Academy of Ophthalmology, and so on. We have also got the Kellman Award, the Baracker Award and the Cassibier Award to the hospital's credit. And then of course numerous citations and peer review and our own published articles in peer reviewed journals, which all are, I think, a very strong point as far as academics are concerned. We have now a huge number of aspiring ophthalmologists and ophthalmologists who've already been trained and undergone the master's degree coming for fellowship and further training to our hospital, to the Dr. Agarwals Eye Hospital here, and this I think is mainly because of the amount of research and development that they see here, the amount of innovation that they see coming out of the institute, and also the amount of the wide exposure that they get to all departments, to all fields, to every kind of patient, right from the simplest patient to the most complicated case, the most challenging case. And I think this inspires all of them to come here and join here and get experience in the fields of their likings or choices. I think when an ophthalmologist comes here, he gets in touch with all the latest high-tech equipments, investigative modalities, diagnostic modalities, the therapeutic procedures, the simple procedures as well as the complex cases, and they get to see all these and learn all these, take part in the surgeries and they get to see all this and learn all this, and they get to utilize it in their future careers. And I think this is the reason why many of them come here. Also they see the hard work that is being done by the team, and that inspires them to think more and think out of the box. I've had a wonderful experience in Agarwals Eye Hospital right from the time that I joined about 11 years back, and I've enjoyed every moment that I spent here, every moment that I saw patients, that I operated, and that I did academic work and research, every moment of surgery. It is encouraging the idea to think out of the box. I've learned this from my mentors, Dr. Amar Agarwal and Dr. Agarwal, both of whom always encourage you to think new. And the concept that I learned from this was textbooks are not the final answer. Textbooks have also been written by ophthalmologists like us, and somebody had also thought of those new ideas. So this encourages you to constantly think of new ideas, new innovation and new research. Think out of the textbook, think of new answers to possible problems, to think of new solutions to possible problems, and try to get them to be a practical reality and apply them to get the best possible results for your patients. Dr. Agarwals Eye Hospital, as I envisage it in 2020, would not just be confined to Chennai or Tamil Nadu or to India, but it would have a completely international presence. It would be an online hospital, an online community, with employees all over, with patients all over the world, and with each person being able to talk or communicate with other. And I also think that we would be at the forefront of technology. We already are very much of it, but we would be there right at the top, competing with the best hospitals. No, cut that off, we're already doing that. And I think we would also be at the forefront of technology. And I think we would also be at the forefront of technology. We would be there right at the top, the world #1 in ophthalmology, where all ophthalmologists from the world over would be vying to come here, to work here, to learn from the experiences of people here. And I think we would again be bringing out a huge number of innovations and new technologies, and we would also be aiming to make this technology available to everyone, to even the poorest person and to the most remote corner of India.